Luke Goodrich is next, but first, it was a historic week at the Supreme Court. For the first time in history, oral arguments were made by phone due to the coronavirus pandemic. Among the cases being argued were the Little Sisters of the Poor's ongoing fight against the Obamacare contraceptive mandate. Despite winning their case against the mandate in 2016, the sisters have found themselves back before the High Court in an effort to avoid having to provide contraceptives and abortifacient drugs to employees in their health care plans. Here to discuss those oral arguments at the court and why the sisters are once again arguing against this contraceptive mandate is senior counsel at the Becket Fund and author of Free to Believe, The Battle Over Religious Liberty in America, Luke Goodrich. Luke, as I mentioned, this is the first time the court has heard these oral arguments via phone with the audio streamed live to audiences around the world. What has it been like to hear the arguments made in this way and for you and your colleagues?
It's been fantastic, actually, to hear the arguments real time, live, and the whole world can hear the case of the Little Sisters of the Poor. It is fantastic because the Little Sisters are doing the greatest work on behalf of the elderly poor. And every justice has been asking good, hard questions in turn, and the lawyers are prepped. And it's really a fantastic discussion, and it's a great chance to be part of history.
It's a heck of a podcast, I'll say. Now, this is not the first time that the Little Sisters have been in front of the Supreme Court. As I said earlier, in 2016, they won their case at the Supreme Court and were told that they didn't have to provide contraceptives and abortifacients. In that 2016 case, it was also made clear that the government could find ways to distribute contraceptives without the involvement of religious nonprofits in their health plans. So why are the sisters back again, Luke? I thought this was done.
Yeah, this has been going on almost a decade now, and it all started when the Obama administration, back in 2011, tried to force groups like the Little Sisters of the Poor to include all forms of contraception in their health insurance plans. And the Little Sisters said, we can't do that. It's against our religious beliefs, and the government threatened them with multi-million-dollar fines unless they violated their conscience. And we at Becket took their case all the way to the Supreme Court. And as you said, the Supreme Court told the government, look, surely the most powerful government in the world can find a way to distribute contraception without using Catholic nuns. And after that, President Trump was elected, and the Trump administration issued a good new rule that protects the Little Sisters of the Poor.
They changed the rule.
That's right. And that should have ended it right there. But several blue states, Pennsylvania, California, they then sued the Trump administration, sued the Little Sisters of the Poor, and actually argued that it's illegal, that it should be illegal for the government to protect nuns who care for the elderly poor. And that's why we were back in the Supreme Court again, arguing again that it is perfectly lawful and indeed the right thing to do to protect the Little Sisters of the Poor.
So ridiculous. In yesterday's oral argument, Justice Ginsburg, who called from her hospital bed, she was treated for a gallstone infection. She had this to say about the government's to the government's top Supreme Court lawyer, Solicitor General Noel Francisco.
You have just tossed entirely to the winds what Congress thought was essential, that is, that women be provided these services. With no hassle, no cost to them. Instead, you are shifting the employer's religious beliefs, the cost of that, onto these employees who do not share those religious beliefs. The women end up getting nothing. They are required to do just what Congress didn't want.
Now, that point about employees not agreeing with their employers have been made many times before. One can choose who to be employed by, correct? And aren't there many companies that choose not to have contraceptives as part of their insurance plans?
That's absolutely right. When Congress passed the Affordable Care Act, they allowed employers of millions of employees to not provide this kind of coverage simply for administrative convenience, because President Obama said, if you like your plan, you can keep your plan. So there have always been employers who are exempt from this contraception mandate. And all the Little Sisters of the Poor are asking is, we should be treated no worse than all the other thousands of employers that are exempt. And as the fact of the matter is, the Little Sisters of the Poor, their employees actually like working for the sisters, and they're not trying to demand the sisters violate their conscience. It's simply the government trying to force the Little Sisters to violate their religious beliefs.
A hypothetical question comparing birth control and a potential COVID-19 vaccine was presented during the oral arguments. Justice Sotomayor asked this to Paul Clement. Now, he's the attorney arguing on behalf of the Little Sisters. Listen.
Assume that the government tomorrow passes a law that says every insurance company must reimburse every policyholder they have for COVID-19 vaccine. You, insurance carrier, must pay for anyone who submits, who has a policy with you, for anyone who submits for a COVID-19 vaccine. Can the employer object to pay to that policy?
So, Justice Sotomayor, I think the answer is no, and if I'd like to explain kind of how I would work through that.
Mr. Clement, exactly the same rules that apply here to contraceptives, meaning all they have to do is tell the government that they object to vaccines.
Luke, how would you argue that point? And is that analogy of a vaccine to contraceptives appropriate or apt?
I think Paul Clement said it just right. And the difference in Justice Kagan's hypothetical and the actual case, Justice Kagan is saying, what if every employer is required to cover a vaccine? Well, that's not how the contraception mandate works. There are employers of millions and millions of Americans. Pepsi Company is exempt from the contraception mandate. And so the Little Sisters of the Poor are saying, if you will exempt thousands of employers for no better reason than just administrative convenience, you need to exempt them for religious reasons of religious conscience. And that's a powerful argument, and it's one that we think is going to carry the day.
I want to get your overall impression of these oral arguments. The Trump administration in 2017 offered a religious and moral exemption to the mandate. As we mentioned earlier, they changed the rule. Yet the moral exemption wasn't argued very much. In fact, the Pennsylvania Chief Deputy Attorney General highlighted that the moral rule wasn't talked about in the oral arguments. Why do you think there wasn't a greater emphasis on that religious part of the exemption, and why was it not brought up during the oral arguments?
Yeah, the interesting way that this case is litigated by the states, Pennsylvania and California, they're trying to say it's an all or nothing choice. And their argument is the government doesn't have any authority whatsoever to create any kind of exemption, not just for the Little Sisters of the Poor, not just for moral reasons. They argue that you can't even exempt churches, that the church itself could be forced and has to be forced to provide contraception in violation of conscience. And, you know, as you might not be surprised, that argument didn't really make much headway with the justices because, you know, the idea that you can't even exempt churches just isn't going to fly.
Yeah. In an op-ed, Sister Lorraine Marie McGuire, she's the Mother Provincial of the Little Sisters of the Poor, she wrote this ahead of the oral arguments. We cannot hold the hands of the dying elderly while at the same time facilitating the ending of preborn life. Our faith will not allow it. As we wait for this decision, what is at stake for the Little Sisters of the Poor, Luke?
The Little Sisters right now are going through an extraordinarily difficult time due to COVID-19. They are literally on the front lines of the battle. They have been living with these residents for years, and due to some of the isolation measures, they sometimes can't be there to hold the hands of patients who are suffering through this virus. And so it's an extremely difficult time. And then on top of that, you have states like Pennsylvania and California trying to force the sisters to violate their religious beliefs. So, you know, the sisters are going through a difficult time, but the most amazing thing has just been their courage throughout this decade-long ordeal. I mean, they are fueled by something far deeper than any government mandate. They are fueled by their faith. And it is truly an inspiration to stand behind them in court and just tell the government, let the nuns serve, let them care for the elderly poor as for Christ himself. And it's just a joy to do that with the sisters.
Luke Goodrich, thank you for being here. Luke's book, Free to Believe, The Battle Over Religious Liberty in America, is available at bookstores everywhere and online. Thank you so much, Luke.
Thank you, Raymond.